Very good morning. Today we'll be speaking about the impact of lid hygiene on ocular surface biomarkers. So as we already know, the ocular microbiome has a uh, uh, very big effect on the ocular inflammation, which in turn leads to release of cytokine and MMP activation, leading to damage to the ocular surface and becoming a vicious cycle. It increases the biomarkers, causing more inflamed ocular surface. So routinely we treat ocular inflammation with drops like cyclosporin and sodium hyaluronate and trehalose combination. And there are also procedural therapies available now that we use. But are we targeting the root cause? Are we missing something which is very basic but very important? That led us to thinking of the role of lid hygienes in ocular surface inflammation. There has already been a lot of published data on the effect of eyelid hygiene, which causes reduced inflammation, stabilizes tear film, and causes the meibomian gland to be healthy, which led us to our research question, which is that do lid hygiene have an impact on ocular surface immunology? So we did a prospective randomized case control study where we included 25 healthy subjects. This mainly included our hospital staff and our colleagues, where we cleaned the right eye with the lid wipes and left eye we used as control. The study was standardized by using the wipes in the hospital at the same time twice a day by the same person, and keratography, NIBUT, and tears were collected before using the lid wipes at the 1 week and 4 week mark. The study lasted for 1 month. The lid wipes that we used composed of tea tree oil and castor oil, which facilitates the lipid layer thickness, and it also contained coconut oil, which has anti-inflammatory properties. This is a short video of how we use the lid wipes. We basically cleaned the upper eyelid margin twice, followed by the lower eyelid margin twice. This was done for the right eye of each participant, and the left eye served as control. What we found is that in 4 weeks, the lipid layer analysis of the eye with the lid wipes had improved. The same with NIBUT. We found that there was significant improvement in the NIBUT with the eye that we used lid wipes. So we went back and we assessed the tears of all of these patients, all of these participants, using the BioM Pathfinder kit, where we collected the tears in Eppendorf tubes and we stored it in minus 80 degrees Celsius. We used our BioM Pathfinder kit, which basically detects the tear-soluble inflammatory markers with fluorescent-based microfluidic device. And in just 90 minutes, it gives us the report for 8 inflammatory biomarkers. This is a quick overview of what each inflammatory biomarker stands for. What we found is at the end of 4 weeks, there was significant improvement in almost all the inflammatory biomarkers, and especially MMP9, IL-6, TNF-alpha, and IL-17, which led us to thinking if we can include lid hygiene in our day-to-day pre-operative workup. And this is a study that is in progress. So we all know that the normal wound healing, there is a rise after the insult, and the keratocytes are made into myofibroblasts, which eventually undergo apoptosis and cause the healing and the wound remodeling. But in an inflamed eye, these myofibroblasts are converted to fibroblasts, which lead to undesired outcomes like corneal scarring, poor nerve regeneration, irregular epithelium healing. So we've now routinely started using these lid wipes as an adjuvant therapy for our various pre-operative workup, especially in patients undergoing PRK, trans-PRK procedure in keratoconus patient. Concluding, lid hygiene could be made an integral part of the pre- and post-operative regimen for all ocular surfaces as an adjuvant for the conventional therapies. Thank you.
Thank you. But these patients, the people who participated here are all healthy volunteers,
Yes.
is it? They are not in the pre and post
No,
operative.
we started with the healthy volunteers since we saw the improvement in the inflammatory biomarkers as well as
In the healthy volunteers also, you saw inflammatory biomarkers increased
yes,
to
so
normal.
yes, we saw an improvement from the baseline that was recorded. There was an improvement, so we started doing further studies where we started using this on inflamed eyes like keratoconus patients. And we up till now we are seeing improvement and reduction in the post-operative haze for keratoconus patient especially.
All right, thank you.
Thank you.